Hi, I'm Vanessa Jacoby. I'm the Associate Vice Chancellor for Clinical Research at UCSF and the Director of our CTSI. Welcome. I'm so excited to introduce Dr. William Brown today. Dr. Brown is an Associate Professor of Medicine and Epidemiology and Biostatistics here at UCSF and a John A. Watson Faculty Scholar. Dr. Brown is the founding director of Code Lab, director of DEI for the Baker Computational Health Science Institute, co-director of the T32 Database for Health Disparities Research Fellowship, and associate director at the Research Coordinating Center to Reduce Disparities in Multiple Chronic Diseases. Dr. Brown's research involves big data, mHealth, natural language processing, machine learning and standards as applied to clinical and behavioral health disparities research with underserved communities. I've had the great pleasure of getting to know Dr. Brown a bit during his participation in the CTSI K-Scholars program the last several years, and I'm so delighted to have the opportunity to hear more about your work today. Welcome, Dr. Brown.
Thank you so much for having me.
Let's get started. Can you just tell us a little about yourself and about your research that's aimed at addressing health disparities in underserved communities?
So a little background on myself. I am the first in my family to complete graduate school and get a doctoral degree, going through UC Berkeley and Columbia for a DrPH and PhD in biomedical informatics. And that has brought me into the world of HIV, clinical and behavioral research, opioid use disorder, as well as natural language processing, machine learning, artificial intelligence through my time in biomedical informatics. I am now a 7-year faculty member at UCSF, which has been a wonderful ride where, as you mentioned before, I started my Code Lab, which currently has students from all over the nation, but primarily from the Department of Epidemiology and Biostatistics PhD program, where we apply different types of technologies such as mHealth, artificial intelligence, and other kinds of like big data tools in order to address various types of health disparities in communities that are underserved, marginalized, or on the margins.
You mentioned how many trainees you have in the Code Lab, and I know you've shared with me how rewarding it is to work with trainees and students and the joy that you get with mentorship. Can you tell me a little bit about your role as a mentor and your experience with working with trainees?
Yeah, absolutely. My trainees and mentees would all laugh because everyone knows that I'm a bit of a mama bear when it comes to my trainees. Very protective, very encouraging, and just want to make sure that they do really, really well in their academic and professional endeavors and work really hard to push out any barriers or anything that's like slowing them down for no good reason. I have amazing, amazing students who work super hard, who are at the top of their game, some of which who I already think are just like right there ready to become faculty members themselves. Just last week, we had a lab meeting where they were working collaboratively, exchanging information, talking about different tools, and beginning the process of thinking about how they can take their current work and enhance it with things like AI and other types of machine learning and things like that. And so right now, I have all PhD students and one postdoctoral student, and the PhD students are all at different levels in their program, but they work collaboratively and they're on co-papers together and co-projects together as research graduate students.
Quick follow-up to that, because you have such enthusiasm when you talk about it. What advice would you give to people who are seeking a mentor in terms of finding the right fit?
One of the things that I tell my mentees when they join me or ask me to be their mentor is, do they have other mentors? First off, it's good to make sure that you build your village of mentorship in order to be your most successful at all ranges, and make sure that you have mentors that understand their role. If you have a career mentor or an academic mentor or a research mentor, mentorship comes in different forms, and certain mentors have different strengths. And understanding which mentors have the best strengths in the areas that you need, as well as asking if those mentors, are willing to help encourage you and speak up on your behalf at times when you can't, at times when you feel like you just can't say no, at times when you need that extra push, at times when you just need a little more support or a little more time or a little more understanding. And then lastly, I think it is important to have mentors that have a understanding of your background and where you come from. So I have a lot of mentees that are people of color. And in that, when they do come to me for, advice, or if a situation made them feel uncomfortable, I can empathize with them, and that helps move through that challenge.
I want to shift a little and talk about two things you're heavily involved in, which is AI and health disparities research. Can you share a little bit of advice about people who might want to get engaged in health equity research at UCSF, and maybe in particular in the realm that you work in regarding bioinformatics and a lot of the AI work that you're doing?
My biomedical informatics work and AI has really increased lately. And this is all because of the nationwide, probably global phenomenon of AI really becoming at the forefront of tools that we use to address many, many problems. And so previously, I worked mainly in subcomponents of AI, so machine learning, natural language processing, and these often work as pieces of AI or elements of AI that, when combined with certain things like large language models or other types of GPTs, then they become more powerful. And so my research has really expanded in the sense that I was first building tools that really relied heavily on pre-programming and training in order to have that tool complete a certain task and address a certain health problem, or assist a patient or a physician in decision making, or the like. And now we have smarter tools that can do that faster, more completely, with a greater sense of accuracy, and that translate and can be implemented much quicker.
I know that you've been involved in a lot of DEI activities at UCSF and a lot of leadership roles there. Can you tell us a little bit about the work that you've done and something that you feel most excited or proud about around that?
In terms of DEI, I am specifically the Director of Diversity, Equity, and Inclusion at the Baker Computational Health Science Institute. And in addition to that, I work with the American Medical Informatics Association with their Diversity, Equity, and Inclusion working group as the liaison from the board of directors. And so some of the things that we've done in both of those organizations for the field of informatics is we've made pillars of success. We've defined what DEI in informatics looks like when done in a successful way. This can be in terms of, bias in AI, or applications of different tools for populations that are underserved. Also, making sure that the members of the American Medical Informatics Association, AMIA, as well as faculty here at UCSF, are heard and seen. So we produce and surveys that get a temperature of the experiences of our faculty, particularly those that are in informatics. Another thing that we do, which is really important, is we help support faculty in writing and completing diversity supplements. Diversity supplements are really helpful supplements that are meant specifically to support the salary and work of faculty from underrepresented groups. And with that, we're able to recruit more faculty to UCSF, get the best talent, and to support and retain faculty here that are already amazing, but could be in a funding lull or be transitioning from one research project to another. And so mainly it's making sure that we are hearing our faculty, that we are supporting our faculty financially and emotionally when possible, and that we are creating opportunities for our faculty to be successful in their research.
You have done so many things that are so high impact to many people at UCSF and then across the country. Will, I know you're working on some innovative projects regarding opioid use disorder. Can you tell us a little more about that?
One of the big through lines with my research and the different projects that I'm working on is that we're working on health disparities that are related to social determinants of health. So both in our national project with the Research Coordinating Center, social determinants of health are some of the common data elements that we are working with to connect all the studies, but it also is a huge, deep component in my opioid research because we want to understand how social determinants of health impact or indicate different levels of opioid use disorder or different potentialities of opioid use disorder. So when we're coming up with those helpful algorithms to help faculty or clinicians rather understand what their patients are going to and what risks they may have when they're being prescribed opioids, we really look deeply into the social determinants of health that may be drivers of opioid use disorder.
So, Will, you're involved in so many high impact research programs. Can you tell us about one that you're particularly excited about right now that you're working on?
One of the projects that has been extremely rewarding and probably the most challenging is the work that I'm doing with our Research Coordinating Center, the Health Disparities one. This one is where it's a new center that we have created, and I'm a part of the Common Data Element and Data Harmonization work. I'm the associate director of that one. And the research that we're doing there is we're in charge of coordinating all the data between several different sites. This is 40 different R01 level research projects that range from children with diabetes to adults and community neighborhood food programs and all that kind of stuff. And so we're trying to make their data work together in a harmonious way so that if there are any cross outcomes between them, we may be able to have that information be more powerful. And so theoretically, some of the things that could come out of that are information about how programs that address things like food insecurity not only help those who are in certain types of communities, but also could potentially have positive impacts on certain youth and other programs. The other thing that I'm working on right now is my K project, which is a project where we're using natural language processing and machine learning, two components of artificial intelligence, in order to develop assistive tools for clinicians when they're prescribing opioids to their patients. And this is really to help them understand which patients are at risk for opioid use disorder, and then to use standards within the research to help them with how they're going to approach prescribing. And that's really exciting because we all know that opioids is a huge challenge right now. Opioid use disorder has really hit the United States very hard, and tools like this can really reduce some of the guesswork from physicians and really aid them at being more efficient and safe in how they prescribe opioids to their patients.
So I'm so grateful for you taking the time to speak with me today. Is there anything that I didn't ask you that you'd like to share with the UCSF community about your work or your experience at UCSF?
One thing that I would like to say about UCSF is it is truly a institution that feels welcoming and collaborative. Particularly when I first joined the Division of Prevention Science, it had a strong sense of diversity and inclusion already there, and equity was already laced throughout how that department was run. And then we all work to support each other, support one another in the research that we do. So collaborations are just commonplace there. So you feel more like it's community. But also because I am more of a methodologist by training, biomedical informaticist, I have had the great opportunity to work with people all over UCSF in a collaborative way that feels welcoming and inviting, be it the Center for Vulnerable Populations or in epidemiology and biostatistics, or even the new division, docket, the Division of Clinical Informatics and Digital Transformation.
Thank you so much. Thanks for sharing. I wish we had a lot longer to talk about your work, but I so appreciate you speaking with me today. And many thanks and gratitude for all of your mentoring and teaching and the elevating of DEI and all of the work that you do. We're very lucky to have you at UCSF and really appreciate your time today.
Thank you so much for having me.